Welcome. In this video, we will contribute to basic research knowledge of OBGYN doctors or trainees. More videos will be published to describe in detail basic concepts. It is important to understand that clinicians need to work with epidemiologists and statisticians to discuss their aspirations and planning for research. The terminologies must be understood and applied to research methodology for having results which are generalizable and valid. Despite this, clinicians should understand the basic language and terminology of research. Understanding research and statistical terms is crucial for physicians for several reasons. First of all, for research interpretations, because you may encounter research studies and clinical trials that utilize statistical methods to analyze and present data. Without an understanding of statistical terms, you may struggle to interpret the results accurately. Statistical terms such as p-value, confidence intervals, and odds ratio help physicians to determine the significance of study findings and assess the applicability of the results to patient care. Other reasons include evidence-based medicine. This is the use of high-quality research evidence to guide clinical decision-making. Physicians need to critically evaluate medical literature, including meta-analyses, systematic reviews, and randomized controlled trials. Statistical terms such as effect size, standard deviation, and power analysis provide essential information for assessing the strength and validity of the evidence, allowing physicians and doctors to make informed treatment decisions. The third reason is that physicians regularly assess the risk associated with various medical conditions and interventions. And these understanding of terms enables physicians to communicate the potential risks and benefits to their patients effectively. Statistical concepts also play a crucial role in understanding and interpreting diagnostic tests. Terms such as sensitivity, specificity, positive predictive value, and negative predictive value will help you to evaluate the accuracy of diagnostic tests and determine the likelihood of the patient having a particular condition. This knowledge is essential for ordering appropriate tests, interpreting results, and making accurate diagnosis. Finally, for quality improvement and patient safety, you need to understand basic terminologies to be able to relate and interpret data for patient outcomes, adverse events, and performance measures. To summarize, by understanding statistical terms, physicians can critically appraise medical literature, make evidence-based decisions, assess risks and benefits accurately, interpret diagnostic tests, and contribute to quality improvement efforts. It enhances their ability to provide optimal patient care and improve clinical outcomes. In this video, we will talk about variables, samples, and population. These are the three fundamental concepts in statistics that are important for physicians to understand clinical research. By understanding these concepts, you can design and conduct clinical research studies that provide meaningful insights and produce reliable results. It is important to choose the right and the appropriate variables, samples, and populations to ensure the study is valid and is generalizable. In statistical terms, a population refers to the entire group of individuals or objects that you are interested in studying. A sample is a subset of the population. For example, if you are studying the effects of a new medication on a specific disease, the population would be all the people who are diagnosed with that disease. The sample, on the other hand, would be a group of people with that disease who are part of the larger population. The population is the entire group of individuals or patients with the characteristic of interest. For example, if a physician wants to study the prevalence of hypertension among adults in a particular area, the population would be all adult residents in that area. It is crucial to understand what is the appropriate population for your research question. Here are some examples of population. General population. This refers to the entire group of individuals in a particular geographic area or a country. For example, a study may aim to understand the prevalence of a certain disease in a general population of a city. Patients with a specific medical condition, for example, pregnancy. So here you will then focus on those people who have got this medical condition. Students in a specific school or a university who are exposed to very similar situations or circumstances. Educational research usually focuses on populations of students within a particular educational institution. Researchers may investigate learning outcomes, teaching methods, or student behavior within that specific population. Elderly populations. There are some studies that concentrate on the elderly population for health issues and for solutions. Minority or marginalized populations. Occupational groups, for example, either interns or residents or consultants or medical officers or nurses. Children or adolescents, again, is another population which can be studied. And specific demographic groups, for example, certain socio-culturally, certain specific groups or certain groups who have similar economic status or ethnicity. These are a very few examples of populations that you may want to study. The choice of population will depend on the research question, the objectives, and the specific content of the study. Here we will introduce another term called distribution of data, which will be explained in later videos in more detail. The distribution of data refers to how the data is spread out or dispersed in populations or samples. The distribution can be applied to different populations, but the most common is the distribution of scores, such as test of scores for various groups in educational research. So the data may follow certain shapes, which means that a few people will get low scores, a few people will get very high scores, but the majority will get average scores. Understanding the shape of such distribution can guide further analysis and evaluation of data. Let's talk a little bit now about samples. A sample is a subset of the population chosen to represent the population. Physicians use samples to draw conclusions about the population. So to be able to have less bias in drawing such conclusions, you must choose your subjects randomly to avoid bias, and they should be large enough to ensure representation. Selecting an appropriate sample size is critical in research, and this is done through very specific methodology. Another term which is very frequently used in statistics is mean or the arithmetic average. The mean or the average is a measure of central tendency used to describe a typical value of the average value in a data set. The mean is calculated by adding up all the values in the data set and dividing them by the total number of observations. So for example, if you have 5 students who have been tested on a certain specific test and they have scores, and out of these 5 students, 1 fails and 1 has excellent score and 3 are average, then you will add up the scores of the 5 students and divide it by 5 to get the arithmetic mean or the mean. And if this distribution is behaving normally, then this is usually in the middle of the data set. Standard deviation is a measure of the amount of variation or spread of the data. A smaller standard deviation indicates that data points are closer to the mean, while a larger standard deviation shows more variability in the data. It is a key tool in evaluating the reliability and precision of experimental and clinical studies. You must have seen this terminology being used very frequently when you have a study abstract or a total study literature. And in this, you will find that the arithmetic mean or the average in front of that will be plus minus SD. And this SD stands for standard deviation. Let's talk a little bit about samples. How do we draw samples from the population? So it is important to understand that sampling method can only be done after consultation with a statistician or a biostatistician. And as mentioned earlier, this is important for the sake of generalizability and validity of the study. Random sampling is a method in which every individual in the population has an equal chance of being selected. And there is a specific methodology for random sampling. Stratified sampling, in this the population is divided into distinct subgroups or strata, and individuals are randomly selected from each subgroup in the proportion to their representation in the population. For instance, if a study aims to understand the prevalence of a disease among different age groups, a researcher may take a stratified sample by selecting participants from each age group. This is frequently seen in OBGYN, where the sample of women in the reproductive age is taken from 18 to 45 years or 18 to 35 years. And then subgroups are made of 5 years or 3 years or 4 years. And then the data is then divided up, and we can see how each subset is performing. Another way to select a sample is convenience sampling. Suppose a researcher is conducting a study on the prevalence of a specific health condition among patients who are visiting a particular hospital. Due to time and resource constraints, the researcher decides to use convenience sampling. They approach patients who are waiting in the hospital's outpatient department and ask them to participate in the study. The researcher collects data by administering a questionnaire or conducting interviews with these conveniently available patients. In this scenario, the researcher is using convenience sampling because they are selecting participants based on their accessibility and convenience. The patients in the hospital's outpatient department are readily available and easily accessible for the researcher to approach and to collect data from. However, it is important to note that convenience sampling may introduce bias into the research findings, as a sample may not represent the broader population accurately. In purposive sampling, a sample is selected based on specific criteria determined by the research objectives. Other methodology is snowball sampling, which is done when you are trying to do research on some patients or some kind of subject, which are very infrequently distributed in the population, and so you use this methodology where you pick up one person, and this one person will give you more contacts, and those contacts will then give you further contacts to be able to collect a sufficient sample for your study. So in cluster sampling, the population is divided into clusters or groups, and in systematic sampling, the sampling methodology involves selecting individuals from a population at regular intervals. So these are just a few examples of sampling techniques. The choice of sampling method will depend on the research question. available resources, and the desired representation of the sample. Now we move on to understand variables. In research methods, a variable is something that can change or vary. It is a characteristic, an attribute, or a factor that can take on different values. For example, in a study about patients' heights, height is the variable because it will vary from person to person. Variables can be things we measure like age or weight, or they can be categories or characteristics like gender or hair color, or even skin color. Variables are important in research and data analysis because they allow us to understand and study different aspects of a situation or a phenomenon. By examining how variables change or relate to each other, we can gain insights and make conclusions about the topic that we are studying. There are two main types of variables in research, especially when you are doing analytical research. Dependent and independent variables are essential concepts in research and statistical analysis. They are used to understand the relationships between different factors and to make predictions or draw conclusions based on data. Some examples of the importance of dependent and independent variables are establishing cause and effect, testing hypothesis, and statistical analysis, as well as in ensuring generalizability. So an independent variable is the one that researchers manipulate or control in order to observe its effect on another variable. The independent variable is considered the potential cause or predictor of the outcome. For example, in a study investigating the effect of a new medication on blood pressure, the independent variable could be the medication itself. The other main type of variable is dependent variable, which is a variable that researchers will measure or observe to determine the outcome or effect of the independent variable. Let's consider a research study that aims to investigate the effect of a specific prenatal intervention on the birth weight of an infant. In this case, the dependent variable would be the birth weight of the infant. It is the outcome or the result that is expected to be influenced by the independent variable, which in this case would be prenatal intervention of any form. So categorizing variables as independent and dependent is a fundamental concept in statistical analysis and modeling, and it is important for hypothesis testing, for analysis, and for interpretation and communication of the variables for the purpose of finding answers. Another important thing to understand about variables is that variables can take on different forms. For example, a categorical variable is one in which there is a distinct category or group. For example, a male or female gender or intersex, single, married or divorced, marital status, or a specific type of treatment A or treatment B or treatment C. A continuous variable is a variable that can take on any value within a specific range. For example, age is a continuous variable. So after 2 years comes 3 years, comes 4 years, etc. Height is a continuous variable. So is weight and blood pressure. So these are variables that can be measured on a scale. Discrete variables, on the other hand, can take on a specific separate value. For example, the number of siblings of a person, the number of children in a family, or the number of correct answers on a test. Why do we categorize variables? So by categorizing variables, we organize them into different groups based on their characteristics. And this is very helpful because it allows us to use the right tools and methods to understand the data better. By knowing the nature of the variables, we can apply statistical techniques that are suitable for that type of data. And it helps us to gain valuable insights and make smart decisions based on what the data is telling us. So categorizing variables helps the researchers and the analysts to make sense of the data and to use it effectively to draw conclusions and to make informed choices. Examples of variables can include age, which can either be a date of birth or in years, or it can be in days, or it can be in months, depending upon what is your population and sample that you're studying. Gender, again, gender now it has many different types of categories. Ethnicity, BMI, blood pressure, cholesterol levels, smoking status, which may be yes or no, or it can be whether how many cigarettes you're smoking, or brand you're smoking, diabetes status, cancer type, treatment response. So as you can see that for each and every variable that has been mentioned here, you may have different ways in which you will be collecting the data. Some variables which are used for studying patients in the labor room include the following, and all of these are actually included in the labor care guide, due to which one of the recommendations and one of the reasons why labor care guide is encouraged and to be used in labor rooms is because now by recording this data, you can now actually study and do research or do interventional studies in the labor room using the same guide, or even do audits. So we come to the last slide. The understanding of variables, samples, and population is important for physicians to conduct clinical research effectively. By identifying relevant variables, selecting appropriate samples, and knowing the population of interest, physicians can draw valid conclusions about their population and about their patients. With this, we come to the end of the video. If you like this video, please press the like button. Please subscribe. We are depending upon you to subscribe to this channel so that this channel can remain viable and continue to produce videos. Please share with friends and with those colleagues who may benefit from it. Please give comments about other videos that you might like to see and for better understanding of research methodologies. And press the notification bell if you wish to be informed about subsequent release of videos. Thank you and goodbye.